With a high blood pressure client, I would decrease the intensity of the exercise and focus more on strength rather than volume. I would also be very cautious of their condition by monitoring it whenever possible and frequently asking them if they are feeling uncomfortable. The best way to monitor the condition would be with a heart rate monitor and directions from the client's doctor as to a suitable max heart rate and training range. The exercises that would be most affected would be the shuttle runs, cycling, and circuit training. The shuttle runs would not be performed until at least a few months of training, and even then they would be slowly worked into the program at a low intensity. With the cycling exercise, I would have the client perform low intensity interval training, where they are riding for 5 or so minutes non-stop. With the circuit, a rest between exercises may be added, or something like burpees could be replaced with less intense exercise like calf raises. I would also seek to raise the weight but lower the repetitions. But as with all exercises, the client would be monitored and slowly eased into the routine from week to week. As every client's condition will be different, the best tactic is to be cautious and use low intensity to ensure problems don't arise. With the shoulder injury, a client I have I'd make a few adjustments to those exercises where the joint is in use. Firstly, I would stress that the client should not force the shoulder flexibility test, as this could be dangerous. I would also not have them perform the arm swings for warm-up as intensely. Similarly to the high blood pressure client, I would be sure to monitor their situation by asking them how they feel regularly. I would also replace the push-ups with a single-arm dumbbell press, as this prevents the asymmetry from taking over and the imbalance from continuing to exist. I would also be very strict with the client's form and only have them perform the same number of reps with the strong shoulder as they could do with the weak shoulder. For this reason, I would also seek to replace burpees in the circuit training with single-arm dumbbell shoulder press. This will be vital for progressing through the rehabilitation process. With squats, lunges, and rows, I would first check with the client that the hanging weight isn't causing discomfort. If it is, then another back exercise could be selected, and in the case of the leg exercises, a belt or backpack of weight could be used instead. Finally, I would ensure an extended period of stretching was performed on the shoulder to help accelerate its rehabilitation. All clients should be treated individually, as an assumption that an exercise will be suitable could cause a problem. If a client had lower back pain, they would be treated much the same as a shoulder injury client. However, the exercises which are altered would be different. They would still be monitored and questioned as to how comfortable they are, as they would still have their workload slowly increased rather than starting at a high intensity. Push-ups wouldn't be affected too much. However, I would need to be very strict with the client's form to ensure they don't lose the neutral spine during the exercise. The exercises I can see being most affected are the squats, lunges, and single arm rows. A suitable replacement exercise for the leg ones are the leg press, leg extension, and leg curl machines. Alternative back exercises to the single arm rows are lat pull downs or the pullover machine. A good exercise to strengthen the lower back and try to fix the pain is performing deadlifts. However, these would need to be completed with extreme caution, because beginning with low weights, low reps, and a large rest period. As every client's condition will be different, the best tactic will be caution and to test exercises at a low intensity to ensure they don't cause a problem before increasing the intensity by increasing the weight, decreasing the rest period, or increase the number of repetitions. I would also ensure to have the client stretch out their back before and after sessions.